morning.
Good morning.
My name is LaQuisha Bowden. Today I will be doing a head-to-toe physical assessment on you. Tell me your name.
LaQuisha.
Okay. Well, let's first off start by saying that you do have the right to refuse this, and I just want to let you know that this will remain confidential.
Okay.
Okay, would you still like to proceed?
Yes.
Okay, well, let's get started. First off, I'm going to put on my gloves. In beginning this, we'll start with the head and the face. First, I'm going to inspect the skin of the face, looking for her hairs, see if any lesions or anything is present. I'm looking for the symmetry of her ears and her eyes, and those are symmetrical bilaterally. I'm going to look for the expression on her face. She does have a normal expression. Next, then we'll start with the scalp. I'm going to inspect the scalp, looking for any nodules, any lesions or lacerations that can be present in her scalp. And then we're going to palpate her scalp. Noting any tenderness. Is there any pain when I palpate your scalp, Miss LaQuisha?
No.
Okay, great. That's good. No pain is present, so that is great. I'm going to assess her temporal arteries. Both of them are present, and they're palpable. Okay, as well, I'm going to check her temporal mandibular joints. Feel on the jaw right here. I'm going to get you to open and close your mouth, Miss LaQuisha. And close your mouth. While doing this, I was checking for any clicks or any pain. Did you experience any pain with that, Miss LaQuisha? Okay, great. Now I'm going to assess her cranial nerve 5. What I want you to do, Miss LaQuisha, I want you to clench your teeth very tightly. Okay? I'm going to get you to try opening your teeth. Okay. Checking for the resistance on that. Now I will check the sensory function. What I'm going to get you to do is close your eyes. Now tell me if you can feel this.
Yes.
Okay. Can you feel that?
Yes.
Okay, great. Good. Her sensory function is intact. Now I'm going to assess cranial nerve 7. And to do that, we're going to do a couple things. First, I want to get you to smile. Okay, now frown for me. Okay, close your eyes very tightly for me. Okay, lift your eyebrows up. Show your teeth. Now puff out your cheeks like you're blowing on something. Good deal. That concludes that part of the head and the face. Now we'll do her eyes. First I will assess cranial nerves 3, 4, and 6, the extraocular movement. What I want you to do, I'm going to have you to look at this pen light here. Okay, I want you to follow this pen light. Okay? Good. Just looking to see if both her eyes are going in the same directions. Okay, now I'm going to assess her pupils. Okay, just look straight ahead for me. Try not to look into the light. Okay. Checking our pupils, making sure that those constrict to the light. Okay, while I'm here, look at this side. Okay, looking for the size of her pupils, making sure that they're round and equal, and they are. We would call this pearl. Pupils equal, round, and reactive to light. Okay, now we'll assess for accommodation. What I want you to do, Miss LaQuisha, I want you to stare and focus at this pen light here. Okay? Now I want you to look at something far distance on that wall, that very back wall. Okay, now look at the pen light. Now far back at the wall. Now with this, we'll notice that if she's looking at this pen light, it'll be close and it's constricting. Now far away from a distance, it will dilate. So that's good. Now I'm going to inspect and palpate her eyebrows. Normal hair distribution. Looking at her eyelashes and her eyeballs. I'm going to inspect her conjunctiva. Looking to see if they're pink and moist. Okay, noting that she does have colored contacts in. Those are in as well. Looking for any drainage. I don't see any drainage or crustacean present. Looking at her sclera. Her sclera is white. No redness, no yellow or jaundice present. Looking at that. And everything looks good. Her eye looks good. That concludes that part. We'll also do the Snellen chart, and that's testing for visual acuity. Now we'll assess cranial nerve 2 for visual acuity, and we'll do that using the Snellen chart. Miss LaQuisha, can I get you to step down for me, please? Okay. Let's head this way here. I'm going to get you to stand right here. This distance is 10 feet away from that chart. I'm going to get you to hold this note card. Covering your right eye, I want you to read the lowest line possible. Okay? F, D, P, L, T, C, E, O. Okay, great. Now remove that card and place it on your other eye for me. Now read that lowest line possible again. F, D, P, L, T, C, E, O. Okay, great. Did you wear any contact lenses in that?
Yes.
Okay, Miss LaQuisha does have her contacts lens while she's performing this Snellen chart, so I would say her vision is a 20/20. Moving along, I'm going to assess LaQuisha's ears. I'm going to inspect her outer ears, looking for a symmetry. They are symmetrical. Turn your head that way for me. Looking for any drainage. Okay. I'm going to palpate her ears. Is there any pain when I palpate on your ears?
No.
Okay, no pain present. Next, I'm going to assess cranial nerve 8. Okay. I'm going to get you, going to close off this ear. Okay. I'm going to whisper something in your ear. You repeat what I said, okay?
Apple.
Okay, good. I'm going to do this here. Repeat what I say, okay?
Baseball.
Okay, good. Cranial nerve is intact. Next, we're going to go to the nose. Just inspecting her nose, looking for symmetry, making sure her nostrils are symmetrical. Palpate it, feeling for any nodules. Let's go ahead and look for some drainage. Going to look up your nose. There's no drainage noted. Okay, next what I want you to do is I'm going to get you to occlude one of your nostrils. And I want you to take a deep breath in. Good. Now we're checking for the patency on this. Okay, going to do your other nostril. Good. And her nostrils are open. They are patent. Okay. Next we're going to check her sinuses. We're going to do the maxillary. Just going to palpate under her eyes. Feeling for any pain. Is there any pain?
No.
Okay. Now we're going to check her frontal. And that's above her eyebrows. Is there any pain when I'm doing this?
No.
Okay, no pain present. Next, we're going to move on to the mouth and throat. Okay? I'm going to get my pen light here. The tongue depressor. Could you open your mouth for me? Okay. Just looking at her teeth, her gums. Looking at the tongue. Will you lift your tongue up for me? Okay, looking at the bottom of her mouth, looking at the back of the throat, looking at the uvula and her cheeks. Everything looks pink and moist in there. Looking at the palate of her mouth. Everything looks good in there. Gonna assess, also I want to grade her tonsils. And grading those, I would grade those about a 2. Okay. I would grade those about a 2. There is no obstruction to where her tonsils will need to come out or anything like that. Okay? Now it says cranial nerves 10 and 11. And to do that, we're going to do the mobility of the uvula. Okay, I'm going to put this in your mouth on the tongue. Okay, I want you to say ah. Ah. Okay. Her uvula is midline and it does move up when she says that. Now, let's see. Open wide for me. Okay, checking for that. I was checking for a gag reflex, and as well, you can tell that it's present when that choking motion comes up. Okay. Put the pen light down. Next, we'll check the symmetry of her tongue, cranial nerve 12. In doing so, I'm going to get the tongue blade. I want you to move your tongue. Open your mouth for me. I'm going to get you to move your tongue around this blade, okay? Stick your tongue out. Okay. And that tongue, it does protrude midline, so that is good. Okay. Moving on, we'll move on to the next. The neck. What I'm going to do is I'm going to palpate her lymph nodes. She does have 10 lymph. Look, we have 10 lymph nodes. First, I'm going to move your hair back. We're going to do the periauricular, and that's before the ear. What I'm using the pads of my fingers, about 3 fingers, in a circular motion. Feeling for that. Now we're going to do postauricular, and that's behind the ear. Then we'll do tonsillary. Okay. Submandibular under the jaw. Submental under the chin. We're going to look at the supraficial cervical, the post-cervical. Okay, then we'll look at the deep cervical chain. What I want you to do, Miss LaQuisha, I want you to turn your neck that way for me. Okay, turn your neck this way. Okay, and now I'm going to look at the supraclavicular. It's right here above the clavicle. Okay, then I'm going to look at the occipital. I didn't feel any swollenness or anything present. Was there any pain when I palpated those areas? Okay, good. Now I'm going to assess cranial nerve 11. And doing so, we're checking for range of motion. What I want you to do is I want you to put your chin to your chest. Okay, that's good. I want you to turn your head side to side. Just turn your head side to side. Okay, next I want you to put your ears to your shoulder. Okay, and then I want you to lean your head back. Okay, good, excellent. Next I'm going to check your muscle strength. What I want you to do, I want you to turn your head that way, and we're going to have some resistance against it. Good. This way. Good. Checking for that is symmetrical. Now we're going to get you to shrug your shoulders. We're going to have some resistance going along with that as well. Try shrugging your shoulders. Good. Good. Her muscle strength is good. Okay, now we'll check her trachea. I'm going to just palpate it, making sure it is midline. Now I will do her thyroid, palpate that. We're going to do that by the posterior approach. I'm going to get you to take a hold of this water bottle. Okay. From the back, I'm going to feel on her cricoid notch. Okay. I want you to get a drink of water. Just hold it in your mouth. I'll let you know when to swallow. Okay, you can swallow. Okay, good. With that, you can feel it moving up. With that, it's not enlarged or anything. You don't feel a goiter or anything. So with that being said, that's good. Okay. Next, we're going to check her carotid pulse. We're not going to do these at the same time because we don't want to occlude that blood flow going to her head. So we'll just do that one at a time. Okay, that pulse is palpable. That one's good. Now I'm going to listen to it. Auscultate it. Okay. In doing so, we're listening for any bruise or swishing of that. And I'm going to listen to it with the bell of the stethoscope. Okay. What I'm going to get you to do is I want you to breathe in and hold it, okay? Okay. We'll do the other side. Breathe in and hold. Okay, good. I didn't hear any bruises or any thrills or anything of that sort, so that's good. Okay, Miss LaQuisha, can I get you to stand up for me? And you can go over there and take your shirt off. We're going to listen to her chest from the back, posterior approach. I'm going to just get you to sit up here for me. Okay, first off, we're going to start off with inspection as well. Looking for any lesions, any tumors or anything, making sure that it's symmetrical. Then we'll palpate, looking for any tension or any pain. Is there any pain as I'm palpating on your chest, the back of your chest?
No.
Okay, good. No pain is present. Now we're going to check tactile firmness. What that is, we're just feeling for the vibrations as you say the number 99, okay? So with the pads of my palms, I'm going to, okay, get you to say 99.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay, good. Those were both even on both sides. We feel the vibrations on those as well. Okay. Next, I'm going to look for her chest expansion. I'm going to just move your garment up here. Okay. With the thumbs in the middle of the back. Okay. I want you to take a deep breath in and deep breath out. Okay. In and out. Okay. Her chest rise, it was symmetrical as they expanded. Okay. Next, we're going to percuss. I'm going to get my reflex hammer. Percuss it. Listening for resonance, which is normal. Okay? Good. As well, we're gonna, while I'm doing that, we're gonna percuss the coastal vertebral angle, the flank area. Just looking for any tenderness. Good. Good. No pain right there, or no kidney tenderness present.
No.
Okay, good. Now I'm going to auscultate. Just listening for any adventitious breath sounds, crackles, wheezing, or rhonchi. Okay. As I place the stethoscope on you, I want you to take some deep breaths in and out, okay? Deep breath for me. Good. Good. listening to her lung sounds. I didn't hear any wheezing, ronca, or crackles or anything. Her lungs sound good. Okay, you can step down and I'm going to get you to come to the front. Sit right down. Yes, you can have a seat. Next, we're going to do her upper extremities. First, I'm going to start off with her arms, inspecting her arms, looking for any bruising, any rashes or lesions present. At this point, I would like to note on her elbow, she does have, she has psoriasis. You can see that dry flakiness, that scaly patches. She does have those here on her elbows. I would note that. Okay, now I'm going to palpate her pulses. We're going to palpate the brachial artery, her brachial pulse. Okay. Okay, her bilateral brachial pulses are good. Now we're going to assess the radial. Good. Now we're going to inspect, palpate the ulna. Good. Her pulses are good and palpable. Now I'm gonna check her capillary refills. What we do with that, gonna check these bilaterally. When you blanch down on them, you see how they blanch, and then when you let go, they should return back pink. And hers do that in less than 2 seconds. So that is good. Next, we're going to move on to the range of motion of her shoulders. In doing so, I want you to flex your arms up above your head. Okay, good. You can relax those. Now, flex your arms behind your back for me. Good. Now, we're going to do adduction and abduction. I want you to move your arms away from you. Now, put them back to your sides. Okay, good. The range of motion is good here. Now we'll do the range of motion of her elbows. In doing so, I want you to bend your arms and straighten them back out. Okay, in doing so, we're going to do the pronation and supination. Do that for me. Okay, good. Now I'm going to get you to do this against some resistance, okay? Hyperextend your elbows. Okay, now extend them here. Okay, doing that against resistance. Very well. Now I'm going to do the range of motions of your wrists, your hands, and your fingers. Doing so with your wrist, I want you to pull them up. Okay, and just relax them down in the middle. Okay, now point them down. Excellent, very well. Now I want you to make a fist with your hand. Okay, now with your thumb, I want you to move it to each finger. Good. Now I want you to spread and close your fingers. Okay. Good. Now we're going to check for the cerebellum. Okay, what I want you to do is your fingers, your arms out. With your pointer finger, I want you to move it to your nose with each side. Okay, gradually I want you to increase in that speed. Okay, that's good. There's no swaying of her hands or anything, that's noted. Now we're going to check for the graphesthesias. With that, I want you to close your eyes, Miss LaQuisha. Now, I'm going to draw something in your hand. You let me know what it is, okay?
Is that a letter V?
It is, that's correct. And we'll do the other hand.
S.
Good, that's intact. Now we'll do the streganosis. I want with your eyes closed. Close your eyes for me, please. I'm going to place an object in your hands. Okay? Can you tell me what that is?
A coin.
Okay, great. Keep your eyes closed for me. Okay? Gonna do this here.
A key.
Okay. Great. That's good. So she was able to identify each object that was placed in her hands. Now I'm going to check her reflexes and rate those. Okay, doing the triceps first. First, I just want to get her arm kind of draped above mine, make it pretty limp, and just relax as best as you can for me. Okay, now we're going to feel for that tendon up above her elbow, about 2 inches. Okay, there we go. And do it again. Okay, and you feel that, you see that motion that she has, so that reflex is intact on that arm. I'll rate that about a 2 on that arm. Okay, feeling for that tendon up here as well, about 2 inches above the elbow. Okay, just relax your arm for me as best you can. Good. There we go. And you did see that reflex moving in her hand. So that's good. And like I said, I would rate those about a 2 in her triceps. Now we're going to do the biceps. Okay. Going to feel that kind of right where that brachial pulse is. Okay. Okay. Let's not do that. Okay. Just relax your arm for me. There you go. And you see how her arm kind of flexed up. You do see that. I'll rate that at 2. Okay. Feeling for that tendon and that brachial. And that's where you want to strike. Okay. And you did see that. So I will rate that as a 2 as well. I'm sorry, that was her biceps. I've been calling it brachial, but that's assessing her biceps. Now we're going to assess the brachial. Okay. Right here. So for that tendon here. Okay. There you go. You see her hand, it kind of, you see that reflex motion going in. There you go. There we go. See that thumb kind of flickering up above. All right. Now, Miss LaQuisha, I'm going to get you to lie down for me, please. Now we're going to inspect her chest. And inspecting her chest, I'm looking for any lesions or rashes. Just looking at her work of breathing, looking at the symmetry of that chest rise and the fall, looking at the muscle use. She is not in any acute distress or anything like that. Now I'm going to palpate her chest. Now as I'm palpating, I'm looking for any nodules, masses that could be present. No masses present. Now with the PMI, I'm going to inspect that. Looking for any pulsations, heaves, or vibration on those thrills, and none of those are present. And usually you can't see that PMI in there. Now I'm going to auscultate her heart sound. In doing so, I'm going to listen to it with the diaphragm of the stethoscope first. First, listening to the aortic, which is the second or third intercostal space, right by that sternum border. Okay. Now we'll listen to the pulmonic, and that's just to the left of that sternum border, across from the aortic, the second, third intercostal space. Now we'll listen to the tricuspid. We'll count down to the 5th one. Okay. We'll move that breast tissue along out of the way. Okay, good. Now we'll listen to the mitral. Will you lift your breast tissue up for me? Alright, good. And that's mid-clavicular line. Same space on the 5th intercostal space. Okay. And listening, so I didn't hear any S1s or S2s or any extra heart sounds. Now I'll listen with the bell of my stethoscope. Okay. Find that second intercostal space. Okay, now we'll go there to the pulmonic. Okay, down to the tricuspid. Lift your garment up for me. Same, 5th intercostal space. Okay, and then we'll move over mid-clavicular. Listening to the mitral. And listening like so, you can pull that down. I didn't hear any heart murmurs or anything of that nature. Now I will that concludes the chest part of her assessment. Now we'll do the abdomen. In doing so, we'll inspect first, we will auscultate, and we'll percuss, and then we'll do palpation lastly. Okay, I'm just going to inspect her abdomen, looking for any masses, any bulging or pulsation. None of that is noted. I'm going to inspect the umbilicus, making sure it's midline, looking for any hernia, see if it's protruding. I will note that she does have some striae noted around her umbilicus area and along the sides. Okay, now we're going to auscultate her bowel sounds. I would note that her bowel sounds are normal active. Now we'll listen to the aorta and her bilateral renal arteries. This is just above the umbilicus. The aorta is. Now I'm going to listen to her renal arteries. Listening for any bruits or anything like that. Okay, in doing so, I didn't hear any bruits that were noted. Now I'm going to percuss her abdomen. Let me get my reflex hammer. Okay, and with percussion, I'll be listening for any dullness or tympany. Okay. Now I'm going to palpate. First, we're going to start with light palpation. And you let me know if you experience any pain. No. No pain. Okay, now we're going to start with the deep palpation. Any pain with any of that? No. Okay, great. Now I'm going to palpate her liver. Kind of get right under there, the rib cage. You can feel the rib cage here. Just palpate under the liver. Okay. And I can note that her liver isn't enlarged or anything of that nature. Okay, that concludes the abdomen, Miss LaQuisha. I'm going to get you to sit on up for me. Okay, now we're moving to the lower extremities. Actually, you can continue lying down. I'm sorry. Lie back down. Okay, with her lower extremities, I'll be inspecting her lower legs for looking at the hair, looking for any edema, bruises, or scars that are noted. None of this note in her lower extremities. Now I'm going to palpate it, feeling the warmth of her extremities, seeing if there's any edema noted. Now I'm going to check her peripheral pulses. In doing so, you can put your legs up. Just bend them up here. Just going to check for the popliteal. Kind of bending that knee kind of helps it. Okay, those are good and palpable. Flex your legs for me. There we go. Now I'm going to be assessing the posterior tibia. Okay, that's good and palpable. Now I'll be assessing the dorsalis pedis. Okay, those are also good and palpable as well. Alright, now we're going to do the range of motion of her hip, leg, and knee. In doing so, Miss LaQeisha, can I get you to raise your, you can relax your arm. Can I get you to raise your legs in the air 90 degrees for me? Okay, good. Now I'm doing with the other one. Good. Now I want you to bend your knee up to your chest for me, both of them. One at a time. Okay. Next, I'm going to get you to point your knee in and out for me. Just point them in. Point your knees inward. There we go. Now point them outward. Okay, now I'm going to get you to adduct and abduct your legs. Okay, just move your leg outwardly. Now in. That's adduct. Now outward, abduct, and in, adduct. Okay, good. Now we're going to do the range of motion of the feet and the ankles. Going to get you to pull your feet up a little bit high if you can. Okay, I'm going to get her to plantar flex. And with that, I want you to do is just, push down. Okay, now push up. Okay, now I want you to, with your ankles, your feet, I want you to invert those in. Okay, do them both at the same time for me. Turn them in. Okay, now turn those out. Okay, now I'm going to do push down with your feet for me. Okay, now push up. Okay, good. I'm going to get you to sit on up for me. Okay. You don't have to stand just yet. Okay. Okay, now in assessing her cerebral function, what I want you to do, uncross your legs for me. Run your right heel down your left leg for me. Now do it the same way, vice versa. Okay, good. She does that well. Now I'm going to check her reflexes and her lower extremities. First, going to assess the patellar. What you first want to do is kind of feel that groove right in there. And that's where you want to strike in. There we go. You see kind of how her foot kind of kicks. I'm going to do this one as well. There we go. Now I'm going to check the Babinski reflex. Okay, you see her feet kind of crunch down versus span out as in the child. Now I'm going to assess her, let me do this side here. Okay, good. Now I'm going to check her Achilles reflex. And where that is, that's right behind the outer ankle. There we go. And you can see those reflexes. They're still about it too. All right, Miss LaQuisha, I can get you to stand up for me, please? Okay. You can face that way. Walk that way. Okay. Now face towards me. Okay, what I want you to do, first I want you to walk on your heels towards me. Okay, turn around. I want you to walk on your tiptoes. Okay, great. Now I want you to hop on one leg towards me. Okay, that's good. Now hop on the other leg. And in doing so, I'm checking for her muscle strength and the cerebellum function. Now I'm going to assess her the Romberg's test. What I want you to do is just stand straight, close your eyes. Looking for any sway or any of that sort, and none of that is present. Okay, next we're moving on to the spine. Just going to inspect her spine, looking for any curvature or deformity. Going to palpate it. I'm going to get you bent over. Palpating her spine. No nodules or any of that noted. Okay. She's bending over. Is that painful for you?
No.
Okay, get you to stand up. Okay, now I want you to bend sideways. There we go. Okay, now bend your shoulders back, kind of like a twisting motion. Very good. That concludes this head-to-toe assessment. LaQuisha, I thank you for participating.
You're welcome.